Well, once I start. Okay. Okay, we are recording. Put you over here.
We have some people slowly joining.
Oh, I don't see them. Do you see them?
Yeah, participants
Okay.
are at the bottom there. Yeah.
Okay. I do not see them for some reason.
We give them a couple more minutes, and then I'll do a little introduction, then we can jump in.
Okay. So in this mode, remind me, Jillian, can people talk? Like, are they muted or are they able to?
They are. So if people want to ask questions, they type it through the chat box.
Okay. Okay.
Yeah. So I think that probably I can start with a little introduction. People are slowly joining, but I would like to welcome everyone for joining us today to the I Rise Above webinar Wellness Collective series. Today, I'm excited about this particular webinar, given that daylight savings is happening this weekend. It always throws me for a bit of a loop, but thankfully we get an extra hour of sleep in the morning, which my children will be very happy about. I'd like to introduce you to Jennifer Balzano, who's a functional medicine certified health coach with Sea Change Health Coaching. Jennifer's mission is simple: to empathetically and gently guide her clients to feel their best while they are managing health concerns. Jennifer's personal passion has always centered on searching for the root cause of disease. Her guiding principle is that it takes more than medicine to get well. She is a graduate of the Functional Medicine Coaching Academy, the only program designed and delivered in collaboration with the Institute for Functional Medicine and led by world-renowned health practitioners in the functional medicine field. So today, Jennifer is going to speak to us about why sleep is medicine. Everyone has a unique wellness journey, but one thing we all have in common is the need for restorative sleep. Current research tells us that poor sleep hygiene doesn't just result in crankiness the next day. In fact, poor sleep impacts our health. Think of your immune system, your metabolism, and your nervous system more than we probably realize. So today, Jennifer will explore why, now more than ever, establishing healthy sleep routines can decrease our risk for chronic disease and mood disorders. She will also discuss ways we can make small shifts in our routines, as well as share our favorite sleep hygiene hacks. So without further ado, I just turn this over to you, Jennifer.
Great. Thank you, Jillian. And hello to everybody. Thanks for coming today. And what better time, as Jillian mentioned, than right before daylight savings. I always take a deep breath because this change can wreak havoc on our family dynamics. So I don't know if anyone out there can relate, but we always kind of take a deep breath right before we change the clocks. And thank you also for the reminder, because it's also so easy to forget to do that. So we will talk about how sleep is medicine and how we can use that as a tool in our toolbox. Something we don't have to go get, something we don't have to buy, something that we already have. Here's my disclaimer that this information is for educational and informational purposes only. Please seek the advice of your physician if you need further information. So this is information to be used at your own risk, essentially. So I love this saying, there are two types of tired, one that requires rest and one that requires peace. So just something to think about. And that's kind of my goal with this session, is to present some information for you to kind of listen, notice, and figure out what resonates and what you identify with. And I know sometimes it's hard to make that distinction. Are you physically exhausted? Are you mentally exhausted? Do you need 20 minutes of sleep, or do you just need quiet? So here's kind of what we'll explore. I'll talk a tiny bit about what functional medicine is for those of you who don't know, and what a health coach is. We'll talk about the science behind sleep and why it's critical. We'll talk about some common sleep disruptions and some common myths surrounding sleep. And then we'll explore some tips for improved sleep, and then any Q&A if you're interested. So what is functional medicine? And basically, in a nutshell, it is the practice of medicine that really works to identify and address root cause of disease. So it starts with the idea of viewing the entire body as one integrated system rather than a collection of independent organs divided up by medical specialty. So the functional medicine model is an individualized, patient-centered, science-based approach that empowers patients and the practitioner to work together to address these underlying causes and to promote optimal wellness. Functional medicine practitioners spend time with their patients, and they really, do a deep dive into their histories and looking at the interactions among genetic, environmental, and lifestyle that can influence long-term health and complex chronic disease. Functional medicine also looks a lot in the unique expression of health and vitality for each person and how that's unique. And genes are not our destiny, but that genes in the environment and how they interplay are really what it's about. So functional medicine practitioners include MDs, NPs, OBs, DOs, naturopaths, chiropractors, psychiatrists, psychologists, acupuncturists, health coaches. And if you're ever interested in looking to see who's in your area who is trained in the functional medicine model, if you go on the Institute for Functional Medicine's website, which is the IFM, they have a directory. City and state. So a common question I always have, or I always receive, is functional medicine the same as integrative medicine? So I always like to address that. And I always say they're very similar disciplines. The one difference is that functional medicine takes it just one step further and tries to identify and address the root cause. So what is a health coach? And in the industry of health coaching, we kind of, it can seem like the Wild West, right? Anyone can call themselves a coach, a health coach, coaching, and they put programs that they are to be approved training programs. So just as a PSA, if you've gone through one of these approved programs, my particular program was the Functional Medicine Coaching Academy, which is this FMCA, which is that year-long training in collaboration with the Institute for Functional Medicine, which is part of the Cleveland Clinic. So in a nutshell, health coaching specializes in behavior change. We are part educator, we are part advocate, part cheerleader, part health hacker, part accountability partner, and 100% dedicated to our clients and their goals. Just how I work with my clients, I just, I use the tools from functional medicine, functional nutrition, mind-body medicine, and positive psychology. For example, I spend a lot of time with my clients brainstorming ideas around meal planning, sleep hygiene, managing overwhelm with medication and treatment, and stress coping strategies. Sometimes I listen, sometimes my clients reflect, and sometimes we talk about trying new skills and strategies. Typical packages with me start with 5 one-on-one sessions, and really just work on using modifiable lifestyle strategies. Like I mentioned, that include exercise, movement, sleep hygiene, and support of healthy eating habits, meditation, relationships, and connection support. We also work on developing SMART goals that align closely with values and visions. And at the end of the day, I encourage small shifts so as not to overwhelm. When I work with my clients, we start off by creating a well-life vision statement that serves as a guidepost throughout our sessions together. An example of that is, I value sleep and nutrition and stress relieving exercises. And conversely, some clients don't have a specific idea where they want to start, but just know that something is not right. So we use tools like the wheel of life. We also talk about obstacles and achieving our goals and ideas on how to sustain progress. And at the end of the day, too, it's also about building this wellness toolbox, right? And just having things at the ready that we already have, something we don't need to buy, something we don't need to purchase. And this is the wheel of life. People always like to see this, that we, as a health coach, we kind of go through these different areas of life to see where we are and where we might want to set some goals. So let's get to sleep and how sleep is a really valuable tool in our toolbox and how it can function as medicine for us. My invitation to you is to think about sleep, again, as a tool in your wellness toolbox. And, just having the knowledge that external factors like events and medication side effects exist and things out of our control exist, we'll explore sleep hygiene through the lens of just laying a really strong foundation for our body to be able to thrive as well as defend against whatever comes our way. So we can't go around the room, but I invite everyone to kind of think about a sleep-related fun fact about ourselves. And if you have a journal or a piece of paper, I encourage you to kind of write it down. This exercise kind of just wakes up our awareness around our individualized sleep. And I guess, Jillian, is okay if somebody wants to throw it in the chat, they can. If they have a sleep-related fun fact they want to share. Is that okay?
Yeah, totally.
Okay.
I'll read them out.
Okay. So we'll just take a little less than a minute to do this.
Jennifer, could you give us an example?
Yes, I have one at the ready.
Perfect.
And my husband said I wasn't allowed to share this, but I'm going to share it anyway. I still sleep with a piece of my blankie from childhood. It serves as comfort for me. It's information to my body. It sends a communication like it's time for sleep. And that's it. I did it. I shared it.
Okay, I have one here from Megan. My bewitching hour occurs at 3 a.m. I wake up and am ready to go for the day, even though I should definitely be sleeping. Wow, that's amazing.
Wow. That's some good awareness. Okay, would anyone else like to share before we move on? Just give it a second and see if anything pops up in the chat. Okay, we'll keep going. Okay, so let's talk about the history of sleep. So really up until the 1950s, sleep was thought of as a passive, dormant part of our daily lives. But the research is burgeoning and the current research suggests otherwise. We now know that sleep impacts more than just how we feel the next day. And these studies tell us that many of our lifestyle choices can affect our quality and quantity of sleep. And the research is just now beginning to reveal all that, how sleep plays an important role in our daily functioning, our mental and our physical health. So let's get to know sleep and start to notice, again, what resonates with you. So there's the 5 stages of sleep. And during the night, we cycle through these 5 stages. Sleep, there's stage 1, 2, 3, 4, and REM, which is that rapid eye movement. And these stages of sleep progress in a cycle from 1 to REM, and then the cycle starts all back over again at 1. So, and to just give you a little perspective, so our bodies were built to wake throughout the night. So the critical piece here in laying the foundation is really to be able to fall back asleep once that happens, right? So what can we do to lay a foundation so that when we wake up in the night, to not start that, oh my gosh, I'm awake, but to shift into, we're going to go back to sleep. So although important restorative functions occur during all stages of sleep, so they're all important, the phases of deep sleep and REM, which are 4 and 5, you'll see in this little infographic, are the 2 sleep stages when our bodies and minds undergo the most renewal. And that is typically called that restorative sleep. So you can kind of see, we start with that drowsy first 5 to 10 minutes, then we go to 2, which is that light sleep, then the moderate sleep, and then bam, that 4 and 5. So different age groups require different amounts of sleep. So this is a great little infographic from this American Sleep Foundation, and you can try to just take a look. I'm guessing we all fall within the 7 to 9 hours range, but it's interesting to see if you have children in the family or if you have people in your family, kind of what they need. And I really find it interesting that gender can play a role in our sleep too. The fact that 18% of women are sleep deprived compared to 8% of men. And I love this study out of the sleep research study in England that shows women actually do need more sleep than men. And the study showed that women's brains need more time to recover and repair from their daily routine. And just 20 minutes more of sleep can make all the difference. And other factors that cause women to need more sleep are we undergo way more hormonal changes throughout the lifespan than men, and our differently wired brains. Women often multitask more than men throughout the day. And my husband hates this fact. Women use more parts of the brain compared to men, resulting in women needing just a little bit more sleep. It's biology, it has nothing to do with intellect. So enter in the circadian rhythm. So what is this circadian rhythm? And it's basically our body's internal clock, right? And so the natural cycle of physical, mental, and behavior stages that the body goes through in a 24-hour cycle is basically the circadian rhythm. And they're mostly affected by light and darkness, which is why when daylight savings and we go in and out of daylight savings, we start to feel a little, our circadian rhythm gets thrown off a little bit, almost like jet lag. And there's a small area in the middle of the brain that controls our circadian rhythm. And this rhythm can affect, sleep, body temperature, hormones, appetite, and our other bodily functions. So that's the hypothalamus, right? That controls the circadian rhythm of all animals. And at night, the brain releases melatonin, which makes you feel tired. Although the circadian rhythm is built in and can work without exposure to daylight, it can be altered by outside conditions. So if you've ever experienced jet lag, you know what it feels like when your circadian rhythm tries to acclimatize to new time zones. And again, daylight savings is a perfect example of our circadian rhythm kind of going, whoa, hey, hold on. So from age 25 on, we generally require that 7 to 9 hours of sleep. But when we get that sleep can differ from person to person. And so we all have this rhythm of 24 hours. Our alignment is probably very different than the person next to us. We all know who's in, like we can all identify, I think, with night owls and early birds. And then I also, something that wasn't in the research, but I do think is true, is there's people that are in between that night owl and that early bird. And so the technical term is chronotype for whether or not you are a morning person or a night person. And the research tells us it seems to be genetic. So if you're a night owl, then likely people in your immediate family are too. But your chronotype might differ with age. So think about toddlers having high energy in the morning to teens who have that low energy in the morning. And then in adulthood, we kind of settle into our chronotype. But the research tells us it's rare for people to completely change from being a morning person to a night owl or vice versa. So I borrowed this infographic from Ayurvedic medicine because I think it's a really beautiful illustration of kind of the 24-hour cycle and how everything during the day, when we think about sleep, affects what happens at night. Sometimes when we just think of sleep, we just think it's a nighttime thing, but really all these things kind of contribute to what happens at night. And of course, what happens at night contributes to what happens during the day. So just take a look at this and see if any of it resonates with you. I usually start at the 6 a.m. point. I don't wake up at 6 a.m. if I don't have to, but it's a good starting point somewhere around there. And it's interesting, you start to dim the lights. This is what I find fascinating, around 7. And we'll talk a little bit more about that. And then turning technology off somewhere in that 8 o'clock range. I think it's helpful to do it even earlier, but depends on your schedule. Okay. So living in this 24/7 technology age and this hustle bustle culture, it's easy, I think, to see how our circadian rhythm can get out of whack and basically wreak havoc on our physical and mental health. Whether or not we're a night owl, early bird, toddler, teenager, middle-aged, or in our senior years, I think we can all benefit from good sleep hygiene. And that word gets tossed around a lot too. And really, what is sleep hygiene? So simply put, sleep hygiene just means really healthy routines around sleep, but also includes what we do when we are awake. So sleep hygiene essentially is your bedtime and wake up routine, and then also everything kind of in between. And why is this important? Poor sleep hygiene increases risk for medical problems that we've probably all heard before: high blood pressure, disruption of the gut flora and the microbiome, insulin management, and just one night of 4 hours of sleep, which is half of what I think we require, can trigger that cortisol rise and our change in insulin, changes in our immune system, negative effects on our mood and our mental health. And there's been a ton of research related to sleep on migraine headaches. And if anybody ever wants to talk more about that, I've done some research there, because I am a migraine headache sufferer, and sleep routine has really been a game changer for me. So here is just another visual of what I just talked about, and how poor sleep hygiene can really just work on all facets of our body, down to low sex drive, poor balance, heart disease, weight gain, blood pressure again, memory issues, mood changes. Okay, so let's talk about common circadian rhythm and sleep disruptors. So lots of things out there kind of saying, hey, I'm going to get in the way. Hormonal changes, like we discussed, right before and during your menses, during pregnancy, perimenopause, menopause, all these fluctuations, especially for women with estrogen and progesterone. Caffeine. So I paused because caffeine is complicated. So the level of caffeine in your blood peaks about 1 hour after you've ingested it, and stays at this level for several hours for most people. So the research tells us that 6 hours after caffeine is consumed, half of it is still in your body. So it has like a 6-hour half-life. And it can take a full 10 to actually completely clear it out of your bloodstream. So this is good to know if you're sensitive to caffeine. And there's a genetic piece to this too, because some people have absolutely no reaction or response to caffeine. And it's thought that they have these sticky caffeine receptors in their body. So caffeine may or may not impact you, but it's worth it to kind of stop and think and notice if caffeine impacts you. And if it does, how do you work around it? I always love to talk about caffeine curfews. And when you can have your last bit of caffeine for the day, it's really worth investigating, thinking about that if caffeine impacts you. So stress and ruminating thoughts, another kind of disruptor. If you are having an argument before bed or really talking about something stressful, you will get a cortisol spike. And that can lead to this adrenal fatigue, and your brain and your body do this awesome job of communicating, and they'll keep that cortisol high, and cortisol is inverse to melatonin, so that melatonin is blocked, right? But you're just living in the cortisol area when you really want to be living in melatonin space. Your eating schedule. So eating before bed gives your digestive system a really big job to do. So let's not do that. Let's not create work. But another, and we're all human, right? So sometimes we do have to eat late, and just knowing this can be helpful. Alcohol use before bed, screen time before bed. So that blue screen does a great job of mimicking the blue sky. So it's the blue and the blue, and it signals our brain to release the cortisol again, which keeps us in that alert stage, which is not where we want to be when we want to sleep. And then 30-minute or longer naps during the day. So if you do need to nap, focus on that 20-minute nap. And then of course, medication side effects can also be sleep disruptors. So here's a list of some everyday habits that we might not even realize that might be secretly zapping our energy. And my thinking here is just think about these and just think if any of these resonate. Watching violent or emotionally charged shows, videos, movies, news, of course. Waiting too long between meals. So the general guidance is to not go more than 5 waking hours between meals. But again, this is highly individualized. So allow yourself to notice what works for you. Working at a messy desk actually results in tasks taking longer to complete. So you use more energy. And this is an interesting one. Planning too far in advance can create an uptick in anticipatory anxiety while adversely affecting our working memory and processing speed. So another kind of energy zapper. Having too many tabs open in our brain, right, causes us to bounce all day long from task to task. Transitioning here, transitioning there can really cause some mental fatigue. And I think the idea here is that women multitask more, they bounce more. So that is another reason to support why we may need a little bit more rest and sleep. Taking phone calls right away, right? So the idea here is to maybe pause, maybe if that phone's ringing, maybe say, I'll deal with that later. I don't want to bounce right now. Slouching puts more pressure on your joints, your muscles, and your ligaments. So your body has to work a little harder to compensate. Taking shallow breaths, once again, reduces the amount of oxygen. And then I love this last one, not tweaking advice to suit your personality. So I know everybody loves unsolicited advice, right? And so sometimes just hearing something that doesn't necessarily resonate with you, and we have the ability to tweak anything that somebody says to us, like, oh, we can throw it in the trash. We can say that doesn't resonate with me. I'm not even going to give it another thought. But it's really interesting when you start to notice how much energy it takes to kind of process and think about something that someone might have said to you. And when you start to feel those emotions like frustration, disappointment, and resentment, how much energy that can kind of zap in our lives. Okay, here we go. So here we go with the research, right? So again, the poor sleep hygiene hits our immune function. It really works with our weight control. So these studies have shown that sleep deprived individuals tend to choose foods high in carbs and calories because of that hunger hormone, ghrelin, or ghrelin, I'm not sure how you pronounce it, but it's that appetite stimulator hormone when we are sleep deprived. And so our lack of sleep also affects the body's regulation of these other neurotransmitters that signal that our body is full. I love the little saying, eat light after dark. And mood, of course, sleep deprivation affects our mood. This study out of University of Pennsylvania talks about a group of participants who were limited to just 4.5 hours of sleep for a week were significantly more irritable, angry, sad, mentally exhausted. But when they resumed normal sleep, they improved significantly. And currently, I just got an email asking if I wanted to join this study at Hopkins. They're always researching sleep. And they're looking at how sleep disruption affects brain function, drug responses, and pain management, which I think is really interesting. So sleep is like medicine. You can take a lot of it and not feel better. So it's basically about taking the right kind of medicine. An example of this is if transitions from deep and REM are disrupted, then we may stay in light sleep all night, which again might not be that restorative sleep we're after. And there's this not so fun fact that missing just 1 hour sleep is considered sleep deprivation by definition, right? So all within in context here. So restorative sleep allows this muscle growth, protein synthesis, tissue repair, enhances that mental function, helps us manage stress, and then of course the immune. Here is a great video I want to show about sleep myths. There's so many myths out there that I think are worth listening to. And again, just notice what resonates kind of with you when you hear these. It is beautiful singing.
Who's always on your side? That's why there's nationwide. That's why there's nationwide. Nationwide is on your side. Hitting snooze will give you extra meaningful rest. Hitting the snooze bar is one of the worst things you can do.
Sleeping positions don't matter.
Now, wrong. Sleeping positions absolutely do matter.
If you snore, you have sleep apnea. This one is critically important to adult sleep physician. Hi, my name is Jordan Jean-Louis. I'm a professor of psychiatry and behavioral sciences. My work focuses primarily on circadian and sleep health.
And I'm Rebecca Robbins. I'm an instructor in medicine at Harvard Medical School and associate scientist at the Brigham and Women's Hospital. In my research, I design behavioral interventions to give individuals the tools to improve their sleep and their health. And today we're making an effort to debunk some common myths about sleep. It's better to be a morning person than a night owl. So one isn't better than the other.
We do have in our society both night owls and larks. There's no question about that. Both of them do very well in terms of their own personal livelihood. The difference is that for a person who happens to be a morning person, because of the way society is structured, they tend to do much better.
We have sayings like, the early bird gets the worm. And unfortunately, that's to the detriment often of evening people. They really live in a morning person's world and often are forced to work on a morning person's schedule.
So what we hope to see happen is that people become aware of the kind of person they are. If you happen to be a morning person, do know that your performance is going to be much better in the morning. If you're an evening person, your performance is going to be much better during the evening hours. Sleeping positions don't matter.
Now, wrong. Sleeping positions absolutely do matter. We all, believe it or not, spend most of our time in one of three positions. Most people are side sleepers. The next most common is your back, and the least common is sleeping on your stomach. The key thing when it comes to sleeping positions is to make sure that your spinal column is aligned and you are supported over the course of your sleep at night in your preferred position.
I will only add that if you happen to be somebody who has positional sleep apnea, the position in which you sleep does matter, because if you are sleeping in a supine position, it's more difficult for you to breathe, therefore you snore a little louder, and your bed partner may not really appreciate that.
Now, pregnancy is a time where your sleeping positions also really matter. During pregnancy, you want to make sure you're comfortable, and ideally on your side so that the belly isn't compressing down on top of you and that the baby's protected. But the key thing for pregnant people is you want to be comfortable. In whatever position you take, make sure that you are supported with lots of cozy pillows.
The cue for jet lag is not sleeping all night.
One of the common things that we hear people say is often, I'll just stay up all night and I'll cure jet lag. And of course, that's not a cure for jet lag. You're just sleep depriving yourself so significantly that of course you will fall asleep at any time the next day. There really is no cure for jet lag, but you can cope with some of the consequences by making sure to walk outside in your new time zone as much as possible, get natural light exposure.
If you're traveling east, do not wait until you get there and try to sleep deprive yourself. You can start to prepare ahead of time. So if you're going to be going to Paris, it's about 5 hours away. So what do? You begin to shift your schedule progressively, maybe 4 or 5 days before, so that by the time you get to Paris, you're already in the Paris time zone.
And try to avoid alcohol. Sometimes that can interfere with your ability to get healthy sleep.
Avoid any type of stimulant. Even if a few days, you would adjust naturally.
Hitting snooze will give you extra meaningful rest.
This is actually a myth.
Hitting the snooze bar is one of the worst things you can do because what you're doing is you're robbing yourself of some of the best sleep. In the second half of the night is when we have most of our rapid eye movement sleep, and that's where we get a lot of the benefits cognitively of our sleep. So if you're hitting your snooze bar 1 or 2 or 3 or worse more times, you're interrupting some of that really valuable sleep when it comes to the standpoint of our cognition.
Sleep fragmentation is really not good because it leads to all kinds of psychological problem as well as physical problem. If you have sleep fragmented, then you're more likely to have cardiometabolic dysfunctions, and your mood is not as positive as it should be.
Instead of hitting the snooze bar, the best thing is to sleep as late as you possibly can. If you have to go to the office at 8 o'clock and it takes you an hour to get ready, set your alarm clock for 7 o'clock and commit to not snoozing. Get up at 7 o'clock and go about your day.
So if you find yourself having to hit the snooze button, it tells you you really need to have a much longer period of sleep. So you may have to think about your lifestyle and see how can you incorporate more sleep in your daily routine.
Napping makes up for lack of sleep at night.
Napping is an interesting concept in our field. It does have its merit. It also has some of its drawbacks.
The ideal duration for a nap is actually about 20 minutes, so it's quite short. So make sure to set an alarm so you don't sleep too long, which will cause you to wake up groggy and might affect your sleep that night.
If you've already had your 7 hours, which is your core sleep needs, there's no point trying to do more. In fact, if you're trying to do more, you could develop insomnia because of that. Taking melatonin will make you fall asleep immediately.
It's not going to be something that knocks you out right away. Melatonin, we call it a neurotransmitter. It's secreted in the brain. It's associated with the transition to darkness in our environment. And ideally, melatonin is a naturally occurring process. But melatonin can also be taken exogenously or as a supplement.
If you're taking short-acting melatonin substances, it's highly recommended you do that about 2 to 4 hours before bedtime. Certainly not right before you go to bed. It takes a while before it becomes effective.
Most of the melatonin that's available over the counter isn't highly regulated, so unfortunately we don't know its purity. The other key thing is many people take far too much. So often you go to the drugstore and you see 10 milligrams, 20 milligrams of melatonin. That's far, far too much. And much smaller doses are important.
You really want to talk to your physician, make sure that you pick the right type of melatonin for the problem that you're having. If you pull an all-nighter, sleep as soon as possible.
Now, hopefully you're not pulling all-nighters because, again, sleep is so important, night in and night out. But if you did get a night of either very insufficient sleep or maybe no sleep at all, this is a myth in some ways because we don't want to just binge sleep as soon as you're absolutely able to. What you want to do is actually get back to your normal routine as fast as possible. So that means maybe trying to push through the day and wait until your regular bedtime, maybe taking a nap in the afternoon if you're tired, but trying to get back on your normal schedule as soon as possible, not necessarily sleep as soon as possible.
That's an excellent point. I would only add that if you happen to be a young person, that's really true. A couple of days before you're back on schedule, but if you happen to be an older person in your 60s and 70s, it could take you up to a week to recover. So you have to think about, what am I doing? Do I have to do that because there's a price to pay? Particularly if you happen to be an older person. Dreams only last for a few seconds.
Now, dreams don't only last for a couple seconds. They can be a couple seconds, they can be a couple minutes, and they can be longer.
We all dream 4 to 5 times a night.
And it happens predominantly in rapid eye movement sleep. We believe about 80% of dreaming takes place then.
You could have a dream episode that lasts about 5 seconds. And when you are recounting what actually took place during the night, you feel as if you had this dream for like 2 or 3 hours. You could also have a dream that lasted 10 minutes, and then you feel it really should have been about 5 seconds. It has to do with the emotional content of the dream. And in fact, most people remember their dreams because of the thing that they see. If you see the loved one die in a car accident, you're going to remember this.
There's no precise duration of dreams. We know less about their kind of quantity and length. But what we do encourage is to have fun with your dreams. Talk to a loved one, maybe keep a dream journal.
If you snore, you have sleep apnea.
Now, snoring is one of the most common symptoms of a condition called obstructive sleep apnea, which is life-threatening. But snoring doesn't necessarily mean that you absolutely have this condition. Many people snore and are completely healthy.
So essentially, snoring or sleep apnea is really a mechanical problem. That is, because of the excess weight on the upper airway, you put too much pressure on your throat, therefore the airway collapses either fully or partially. That's what snoring really is. It's you making effort trying to keep the upper airway open.
But if that snoring is coupled with excessive daytime sleepiness, or if you've ever been told that you wake up over the course of the night or stop breathing or gasp for air, those could be signs of sleep apnea.
Sleep apnea is a very serious problem. Some people can actually die in their sleep. This one is critically important to our sleep physician. We do not want one more person to die of a heart attack or a stroke because of a problem they could have fixed. So you really have to understand if that cardinal symptom of snoring shows up, talk to a physician to make sure that you don't have sleep apnea. And if you do, we can actually help you breathe better, sleep better, therefore have a very productive and long life.
Insomnia means you can't fall asleep.
It's partly true, partly not so true. If you happen to be somebody who can't fall asleep fast enough, then you have what we call sleep onset insomnia, which is true. But you also have the other one, which is that you fall asleep okay, but you wake up multiple times so at the night you cannot go back to sleep. That's sleep insomnia.
Now, insomnia is best treated with a healthcare provider, and there are pharmacological treatments, but there are actually behavioral treatments that are incredibly effective, and that's called cognitive behavioral therapy for insomnia.
So if you're not sure what to do, we could consult a sleep physician. They'll be able to guide you. If you can't fall asleep anywhere and at any time, it means you're a good sleeper.
Now, this most definitely is a myth. Believe it or not, it actually takes time to fall asleep. The hallmark of a healthy sleeper is actually what we call sleep latency, or the time it takes you to fall asleep, of about 15 or 20 minutes. If you're falling asleep right away, it generally is a sign that you're not getting enough sleep.
A good sleeper really is a person who can function throughout the day, not falling asleep at an inappropriate circumstance. Most people need about 7 to 8 hours to function optimally. But the fact that somebody might be a short sleeper, 5, 6 hours, if they're functioning optimally during the day, they can go home and spend time with the family, walk the dog, play with the cat, then that person is a good sleeper. But if you find that you're sleeping 5 hours when you're at work, you fall asleep, you can't function properly, your mood is not what it's supposed to be, then you need to get a bit more sleep.
More sleep is always better. Now, this is a myth. More sleep is not always better, because in addition to getting sufficient duration, when it comes to sleep, consistency is critical. So if you look at maybe sleeping in or extending your regular sleep times well beyond what you typically keep, then that's going to throw your internal biological or circadian rhythm completely out of whack. So instead of sleeping in on the weekends or maybe binge sleeping, the ideal thing is to get onto a schedule and try to keep it as close to Monday through Monday as possible.
What we don't want people to do is to feel, I have to sleep 8 hours. If you're physiological for 7, then that's perfectly fine. If it's 6, that's perfectly fine. The question is it optimal for you?
Nightmares and night terrors are the same. Now, these two things are distinct. Nightmare is, of course, a disturbing dream, and a night terror is actually something that we call a parasomnia, which refers to abnormal behavior that occurs during sleep, but it largely happens in children and does generally go away around puberty. Now, there are similarities with these two things, but the one difference is that a night terror can be very disturbing for the person who isn't sleeping to observe in a sleeper. Anyone experiencing night terrors is thrashing about violently, and so it can be a little bit disturbing to watch.
Nightmares tend to be a resultant of things you have been exposed to during the day. If you had watched a horror movie, some of those meditations can carry on during the night episode. If you happen to be under significant stress, you're not doing so well at work, all of those can cause nightmares.
One exception is the environment. We find experimentally when we manipulate the temperature, so we put sleepers under heat blankets so we can make sure that they're nice and toasty, we actually see that their sleep fragmentation increases and their reports of nightmares as well. So make sure that your bedroom is on the cooler side. We generally recommend about 68 degrees Fahrenheit for an optimal sleeping temperature.
Those sleep myths we talk about, maybe there are more, but at least for now, we know these are the ones that are counterproductive to our health and well-being. Let's all have a good night's sleep.
Are we ready?
Okay. So hopefully that was encouraging and educational, and hopefully you left thinking, left that video thinking there's room to grow, right? There's room for us to cultivate healthy soil as in the framework of our sleep. So sleep thoughts reframed, right? We know that our thoughts can greatly affect our physiology, and our thoughts around sleep are absolutely no exception. So when you think of your brain as a garden and your thoughts as the seeds, those seeds of thought that you plant are largely up to you, and that can be super empowering. So if you have a piece of paper or you want to share, I just encourage you to write down some thoughts about your sleep and just notice. And the challenge here is to write down one negative thought about your sleep and then try to reframe it into a positive, because we do have the power to reframe, right? So one example is, even if I don't sleep well, I will cope tomorrow. That is a good one to say in the middle of the night when you wake and you're saying, oh my gosh, how am I going to get through tomorrow? And so the idea here is that when we worry too much about sleep, we're subconsciously programming our bodies with that messaging, and that our inner talk can really be the game changer. So why don't we just take a minute? If anyone wants to throw anything in the chat, they're more than welcome, to just write down one negative thought that you might have. And if you don't have any negative thoughts, that's awesome, no pressure. But if you do, try to reframe it into a positive. Okay, so if anyone wants to throw anything in the chat, go ahead. If not, we'll just keep moving on. But the idea, the takeaway here is to start thinking about that narrative in your brain about your own personal sleep. So how can we lay the foundation for good sleep hygiene? Remember, it's personal, right? So we just have to notice what works for you and against you. So the idea is to create a personal sleep and wake routine. And there's a really good, if you have an iPhone, you can use the Health app. They with the newest update, they've got some prompts for routine and wind down. It's just something to explore there. But really set your expectations and know that you can't expect your body to go from full speed to standstill without slowing down first. So our environment, what can we do in our environment to set the stage for sleep? So this is all kind of in the context of a sleep routine. No electronics in the bedroom is a great place to start. You want your brain to associate bedroom with sleep. And as the video said, the optimal temperature in the house is around 68 degrees for adults and 65 to 70 for babies and toddlers. I don't know if you have thermostat wars in your house, but we certainly do. Great topic for our dinner time conversation. Try switching your smartphone to night shift mode. Just something to explore. This reduces that blue light exposure, and then dimming the house after dinner when the sun goes down. And that can mean no overhead lights, maybe just some lamps or a candle. And then if you do wake up, the current research says try coloring. Just have some crayons available and coloring, because it's such a passive activity. If you read, you're kind of engaging yourself again, and you kind of want to stay in the passive state. And it says if you're lying awake more than 30 minutes, then get up and go sit in a chair somewhere else, read and color, and then go back to bed. And you have to repeat that cycle if necessary, and that cues the body that the bed is for sleeping only. And I highly recommend listening to stories than reading, but it's what works for you, obviously. Bedtime and wake time. So while we may like variety and excitement, our bodies crave routine. So the idea here is, again, to try to sleep and wake around the same time each day, even weekends, to try to train that circadian rhythm. And set that reminder, or use the Health app if needed, whatever works for you. Exercise. Of course, we know that aerobic exercise 4 to 5 times a week for 30 minutes is equal to Prozac for mood. And now the research is saying maybe equal to a low dose of Ambien for sleep. So when you exercise on a regular basis, you're making your body hot during the day, right? So it can actually get cold at night, which will set the stage for good sleep. Natural light, right? So natural daylight for at least 30 minutes a day, no matter how you can get it. And then an awesome tip is that 10 minutes, especially first thing in the morning, that actually sets a timer on your melatonin release for that night. Caffeine and food. So that caffeine curfew that we talked about, that eating light after dark, limit eating to 2 hours before bedtime. And if you need a snack, choose something high in protein to prevent that hormone roller coaster and help that tryptophan and the amino acids production so that your natural melatonin can start to react. Foods that contain tryptophan are hummus, nuts, high-fat yogurt, salmon. They all work to actively promote sleep by converting to tryptophan. Foods that contain GABA, that's the brain calming amino acids, are broccoli, cabbage, cauliflower, mushrooms, and spinach. And GABA promotes relaxation. Hydrate with water, and especially with a lemon or a lime, because that's that electrolyte kind of opening you up so that you can absorb more hydration and get moving. When you drink water in the morning, it actually signals your brain like, hey, I'm awake, it's time to go. Quiet the mind. So practice positive sleep self-talk. For some people, that means meditation, guided meditation. For some people, that means mantras. There's a really good 4-7-8 breathing exercise developed by Andrew Weil out of Weill Cornell that you can look up, that he does a really good job of explaining how this breathing exercise, if you do it 2 times in succession when you're laying in bed, can really set the stage for sleep. So back to an action. If you want, we would love to hear one of your favorite bedtime or wake up routine aspects that you have. That would really be inspiring to me and to everybody in the group, if anybody wants to share. And you can throw it in the chat. Let's see. Is everybody?
I'll go first, if that's okay, and maybe you'll want to participate. So I have found there's a few things that you have said in your presentation that I've started to implement into my routine, because once I started to go on various medications, aromatase inhibitors, and so forth, I really felt like it affected my ability to stay asleep. Mm-hmm. And so I started to implement things like, no eating after supper time. And I'm a huge drinker of water. I consume copious amounts. And so I started to monitor how I was consuming water, what time, and try and put like a 8:30 dead stop, because if I drank too much past that hour, I would inevitably need to wake up and go to the bathroom in the middle of the night, which then completely woke me up. So I started to not do that. And then I really love the Calm app. They have some really great sleep stories, but also just meditations, and to help me kind of like, soothe into my nighttime routine. So that's all been really helpful. There's somebody who has a few people have put in the chat box, so I'll just read those out loud. Abby says, dog cuddle time for 30 minutes before bed. After that, everyone on the floor, too hot. That's pretty good.
That's good.
Megan says, I definitely use a sleep mask and have for years. A warm shower before bed usually triggers my body as well. IV hydration powder for sleep has been good, as a tea before as well. Of course, taking a low dose melatonin, magnesium, and cortisol manager are my nighttime meds. Those are all good too.
Yeah, great tips. And so the next thing I kind of invite you to do is maybe write down one game-changing shift in your sleep routine that you're willing to make this week, and bonus points if you can pair it with an existing behavior. So when we talk about behavior change, we talk about habit stacking, and how it's easier to make a shift when you pair it with something else. So just take a few seconds here for everyone to kind of think about that and kind of notice and see if anything resonated with you that you would like to try, and just kind of see if that makes a difference for you.
Can you give us an example, Jennifer?
Yeah. So one thing I like to do is when after dinner, when I like to like go through the house and kind of shut down the lighting while I'm cleaning up the kitchen. And then at the same time, I'll throw on adult lullabies on Alexa. And it just kind of like it starts that whole process, whether or not I go to bed in the next hour, the next 3 hours. For me, it's kind of like that transition time and kind of shifting into something. So I already know I have to do the dishes, right? Like, or like we kind of do it as a group effort, but ultimately I like to be the last one in the kitchen. And so if I can stack and do a few things at the same time, like playing those lullabies, feels good.
There's a question. It's not related to this specifically, but probably what we were just talking about. So maybe we could finish this activity and then I'll share it.
Okay. So we'll move on just in the interest of time, but I just challenge everyone to think about one shift they could make, or they could pair with another behavior. And if anyone wants to share, of course, feel free to throw it in the chat, because again, it might be inspiring to someone else who just might not have thought of that. So of course, again, just reminders for shifting behavior. If you feel so inclined, it's progress, not perfection. So if you have a bad night's sleep, don't be discouraged. You can jump back on the next day, be on time, but be flexible with yourself. And of course, always invite grace. So these are a few of my favorites that I threw up here. Netflix has this great Headspace guide to sleep, and it even has a guided wind down. Again, it's blue light, so do it early. Don't wait, or just watch it during the day if you feel so inclined. Eating an apple for energy mid-afternoon, so choosing something rather than caffeine or a stimulant to help stabilize that blood sugar. But there's a lot of research in that the energy from an apple can kind of mimic the energy from caffeine. So I just throw that out there, something to try, more bang for your buck. It's a slower release of energy. On YouTube, the Doctor's Pharmacy has a great video on hacking your brain through food and sleep. Mark Hyman, of course. I use a sound machine ever since my son was born, and now my dog can't sleep without it, and we can't sleep without it. There's also a white noise app on iPhones if you're ever traveling, and I love the brown noise as opposed to white noise. Those adult lullabies I talked about, or your favorite calming music after dinner. And then another favorite thing I like to do is, if I am feeling sleepy during the day, just closing my eyes for 10 minutes, even if I don't go to sleep. And then, as Jillian mentioned, the Calm app is great for guided meditations and those adult sleep stories. So I want to thank you for spending the time with me today. I hope you walk away with another tool in your toolbox, and I hope you sleep as well as my dog does every night.
Thank you, Jennifer. We have a question from Danielle, and it reads, is magnesium glucinate better than citrate for sleep?
Right. So there's a lot of conflicting research there. And I'm not an expert on supplements. Personally, I take magnesium every night for migraine prevention, but it also has multiple benefits. And I just take straight magnesium. I don't think it's citrate or glycinate. Is that what it was? So really, I think it's trial and error. I think you have to try and see what works for you. If you're getting that feeling that works for you, then I would just stick with it. I think it's one of those areas that you could check with a functional medicine practitioner on that, or ask on a functional medicine panel with an MD, and they might be able to really sort out the details. But really, I think it would be trial and error. I don't think you can go wrong with either. But if you really want a clinical kind of answer to that, I would ask a physician. But magnesium is wonderful in so many ways.
Well, this has been great, Jennifer. Thank you so much. I really appreciate everything that you shared today with your wisdom on this subject. I think, especially for those of us who've been through or still going through breast cancer, it can really affect sleep habits, and that has a snowball effect that affects everything else in one's life for sure. So this is a really important subject for all of us to figure out how we can clean up our sleep hygiene and start to feel better. So thank you for this.
Great. Yeah, and I'm happy if there are questions post, afterwards, please feel free to reach out. I'm happy to be a resource if I can, or point you in a direction where you can get the answers you need.
Excellent. Thank you so much, Jennifer. Is there any more questions or comments from those who are still in the audience? No? Okay.
Okay.
Well, have a lovely day. Thank you so much.
Everyone. Thank you. Sleep well.